So hello beautiful people, it's your favorite nurse Amara. When it comes to the causes of infertility in women, research have shown that 30% of the causes of infertility come from the women. So what are these? The first one is we're going to talk about problems with the ovaries. Problem with the ovaries, it often leads to either absence or no ovulation. And by this now, when there is absence or no ovulation, that means it will affect the egg that is being produced. Either that there is no egg that will be produced or that low quality egg will be produced. So what are these conditions? The first one, which is the umbrella, is what is called polycystic ovary syndrome, PCOS. Polycystic ovary syndrome. This is one of the major causes that affects the ovary. And then another, premature ovarian failure or primary ovarian failure. Premature ovarian failure or primary ovarian failure is a case where a woman stops ovulating or menstruating before the age of 40. So in bracket is also known as early menopause. Then another thing that causes this is ovarian tumors and follicular disorders. Then another umbrella also that we're going to look at is when there is problems with the uterus. The uterus is the house, what we call the womb. What it does is that it affects or it prevents implantation of the already fertilized egg to the endometrial lining. What I'm trying to explain is some women may not have problem with their ovaries. Fertilization may actually take place, but when fertilization takes place, if they have problem with the uterus, it can even prevent implantation or affect the implantation of the already fertilized egg. What are the things that can cause this? What are the problems that can cause this? Number one is endometriosis. Endometriosis is a condition whereby the endometrial tissues of the uterus are found growing elsewhere in the body, and sometimes it also impairs ovulation. Then another one also is what we call fibroid. I know everybody, you've been hearing of fibroid. Fibroids are benign. That is, when we talk about benign, we are talking about non-cancerous tumors that grow in or outside of the uterus, and most times it inhibits implantation of the fertilized ovum. Sometimes it covers the neck of the fallopian tube. So depending on where the fibroid is, sometimes it prevents implantation of fertilized ovum. This does not mean that the women that have fibroid cannot conceive. No, they conceive, but some, their own may be a problem to other, because some people may be watching this video and they will say, nurse, I have fibroid and I also delivered my baby with it. Your condition and that of another person may not be the same. So now another thing also that can affect the uterus is abnormal structure of the uterus, normal structure of everything. And in some cases we have abnormal structure. Like personally, I have seen a uterus that looks like heart. Like, how will I describe this thing? Like this, you know, the picture of hearts, something like this. I have seen someone's uterus that look like this. It's called biconate uterus. That is uterus, she has two uterus, and we remove that baby from one of the uterus. So there are abnormal uterus, just like normal uterus. There is a way a normal uterus looks like. Some other women, their own is abnormal. So in cases of abnormal uterus, it affects implantation sometimes. Then there is also a condition known as uterine polyps. That is the presence of some growth within the uterine or within the endometrial lining of the uterus. So presence of all these four things that I mentioned can affect implantation or prevent it. Then the third major thing also, the chief third major thing that is also the cause of infertility in women is what we have Tubal disorders. By Tubal disorders, the name Tubal is gotten from the fallopian tube. If you're familiar with the female reproductive system, you know the fallopian tube is where fertilization takes place. I'm going to leave a diagram in this video it is inside this fallopian tube that fertilization takes place. So if there is any problem in this fallopian tube, a woman may not have problem with her ovary, she may not have problem with her uterus, but once there is problem with this fallopian tube, it will prevent fertilization from taking place. Now, if the sperm is coming and the ova is there waiting for the sperm, and there is problem in the fallopian tube, there is nothing that will make the sperm to meet the ova, therefore fertilization will not take place. So what are the conditions that can cause this? The first one is damage or blockage of the fallopian tube. You must have heard some women say that they have blocked fallopian tube, which can be in one of the fallopian tube or in two of the fallopian tubes. Now, what can cause damage or what can cause blockage of this fallopian tube in a woman? First one is a condition known as salpingitis, and this salpingitis is a medical term for the inflammation of the fallopian tube. And the things that can cause the inflammation of the fallopian tube are sexually transmitted infections. Can complicate and become pelvic inflammatory disease, and when this occurs now, it will cause scarring in the walls of the fallopian tube, causing it to block or to stretch. It will stretch together, and there will be no space for the passage of sperm in order to fertilize the ova. Then another condition that can cause this, just like I mentioned, pelvic inflammatory disease, is an infection of the upper female reproductive tract that can damage our fallopian tube, making it virtually impossible for an egg to travel down into the womb. And this is, I've just said it initially, it's a complication of sexually transmitted infection. So any woman that have sexually transmitted infection, make sure you treat it well in order to prevent this. Then another thing also that can cause tubal blockage is what we call permanent family planning, known as tubal ligation, or what women call tying of the tube. That is tying of the womb. Some say it's tying of the womb, but it's actually tying of the tube. When a woman wants permanent family planning and the tubes are being cut and tied using a surgical procedure, in that case, there will be nothing that will make the sperm to meet the ova, so far as the procedure was done well. Another thing also, this one I've talked about the third one. You know, when you are talking about this, some women will be checking themselves to know which one they have. Now, there are some women that will not have problem with the ovaries, they may not have problem with the uterus, they may not have problem with their tubes, but they will have problem with this one I'm going to talk about. That is hormonal imbalance. Like, hormonal imbalance is what most women tend to battle with, whether they are looking for a child or not. Now, when it comes to hormonal imbalance, what happens and how does hormonal imbalance affect fertility? The first one is what we call hyperprolactinemia. This is a condition whereby a condition of high prolactin in a woman who is either pregnant nor breastfeeding. So a woman who is not pregnant nor breastfeeding, for instance, you see a young lady, she should be producing breast milk, but she doesn't have a child, she's not even pregnant, and she's not breastfeeding. So what causes this most times is high prolactin, because prolactin is the hormone that helps out during breastfeeding. So when there is high level of prolactin, it affects the system of the woman because it's not supposed to be there. Another case is also when there is either high or hypothyroidism, that is, it affects the general menstrual cycle and even prevent ovulation. So that's why some women, when a woman starts having problem, like when a woman cannot conceive, one of the major tests that she's even been sent to is hormonal imbalance test. As in, for her hormones to be checked. Now, there are some women, their own may not be prolactin, their own may not be thyroid disorders, but they may be having either high estrogen or high progesterone or low estrogen or low progesterone, like their hormones are not in order. Then another one is cervical disorders. Problems with cervical disorders occurs where the sperm find it difficult to swim through the cervical mucus of the woman because it becomes thinner during intercourse. There are some women, you know, this fluid, when a woman says that she's wet, what actually comes out is from the cervix, the cervical mucus, and that one, that the one that also the vagina produces. So when this mucus, the essence of that mucus that you see, aside that it helps in the motion, in the thrusting, when a man thrusts in, it also helps to transport the sperm from the vagina across and enter the cervix straight to the womb before reaching the fallopian tube. Now when there is problem with this cervical mucus, it affects the movement of the sperm in a woman. Then another thing also is when there is scarring in the neck of the womb. The neck of the womb is the cervix. So when there is scarring in the neck of the womb, it affects the movement of the sperm. It may not even allow sperm to move inside the womb. Talk more of moving up to the fallopian tube. And also in some other cases of cervical abnormalities like cervical cancer. And there are some people that their own is damage that are related to cancer treatment or some medical treatment, like the use of chemotherapy, the use of radiation, and also taking of cytotoxic drugs. These things can affect the ovaries as well as other factors in the woman. Then another one is also the lifestyle and the environmental factors, like the use of anabolic steroids, women that smoke, those that take cigarettes and smoking. And then finally, unexplained infertility. Research have shown that 10 to 15% of the causes of infertility are unexplained. What do I mean? There are some women that don't have all these things that I mentioned. They are free from it. They don't have any problem with the ovaries, with the uterus, with the cervix, with the hormones. Everything in their body is okay, but they are still unable to conceive. They are still unable to conceive. I'm talking about conceiving at all. So guys, I hope that you enjoyed this video. If you really do, kindly like the video, leave a comment, leave your questions, and also share the videos to people that you know will benefit from it. So see you next time. Bye.